Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. Quick note everyone, am I audible and visible everyone? Yes. Okay, that's great. Thank you so much for that confirmation, guys. So, this is a quick session where we are going to discuss top 10. It's actually not 10, but more than that. Top 10 scores and classification in surgery, the ones which are like the must know and frequently asked. And are these mnemonics really helpful? They actually are. If you learn them very well, you put them into your, the reflex recall wala folder in the brain. They help you immensely in the exam when you are under that pressure and you want to easily recall things which are just memory based. Okay, so we'll quickly revise those, guys. And a quick reminder to everyone, in this last month, please solve the mini GTs or the GTs which are heavily PYT based rather than eccentric questions, so that it's a good way to assess yourself based on just PYTs. That is why we have 10 mini GTs test followed by discussions planned on MedSynapse app by Dr. Nikita in the short course. The 5 mini GTs have already been discussed. The mini GT 6 is live today and will be discussed tomorrow in app for subscribers of short course. Right, so it is 36 questions, 42 minutes. So just one section of NEET PG, that is how it is. All the questions, the today's mini GT6 are also based on PYQs and PYTs, not the same copy paste PYQs, but based on those topics. So please give those mini GT and see how do you fare in that. And we'll meet again tomorrow evening at 6:30 p.m. for the discussion. Okay, and starting with the discussion of the scores, the first one that we have, the Southampton wound score, right? The Southampton grading of the wound, surgical wound post surgery, right? The assessment of that which is done for the surgical wound, the surgical site infection ke liye. So the grading that you have, if the wound is undergoing normal healing, it is grade 0. Then you have grade 1 to grade 4 that you have to remember. The last grade is grade 5, which is like deep or severe wound infection, which is there. So in the grade 1, what do you have? So what does, if they tell you that there is just erythema, if they tell you that there is inflammation, if they tell you there is pus coming out, then how will you grade it? So let us have a quick mnemonic to remember that. So remember, the first one is just mild bruising or erythema, basically redness which is there. So bruising or erythema, you remember it as erythema, write it as erythema. A is the first alphabet. So remember, A is 1, erythema is 1. Okay, then you have erythema plus other signs of inflammation. Inflammation ends in shan, that is TO is what is has. So remember, it is grade 2. So inflammation is going to be grade 2. C, clear. C is the third alphabet. So remember, it is clear discharge or hemoserous discharge. Basically, there is no pus. And when it is pus or purulent discharge, remember number 4. 4 is rhyming with foul. 4 is foul discharge, that is pus discharge or purulent discharge. So that's going to be grade 4. So this is how you have easily learned the grading for Southampton wound score. 1 is a erythema, 2 is inflammation, 3 is clear discharge, hemoserous discharge, and 4 is foul discharge, that is pus or purulent discharge. So if you learn it this way, you are never going to forget it, even if you're not able to revise it before the exam. Okay, clear with everyone? Going on to the next classification, very, very important. Todani classification, which is for the type of choledochal cyst. Right, that is Todani classification. So you have type 1, type 2, 3, 4, and 5. So type 1 to type 5. So if I ask you, let's have a quick assessment question first. If there is dilatation involving both the intrahepatic and extrahepatic, then what Todani classification is it? Both intrahepatic and extrahepatic involved? Yes. It is what classification when both intrahepatic and extrahepatic is involved? Very good. That's 4. And what 4? 4A or 4B? Is it 4A or is it 4B? Both intra and extra. Correct, Dr. Agnimita, it is 4A. Right, so how do we learn it? Remember in Todani classification, first remember 1, 2, 3, 4 and 5. 1 is dilatation of the extrahepatic bile duct which is there. Okay, so it's a duct, extrahepatic bile duct which is dilated. Remember it as 1, O for out, that is extrahepatic which is involved. Then 2 is di, and di is diverticulum. So when you see a diverticulum, right, so like you are seeing like this, it's a diverticulum which is present here. So that's going to be type 2. Remember 2 is di. Then you have type 3. Again 3, the C, third alphabet, remember it's a seal. Choledococele. What is a seal? Like the outpouching at the insertion. So where the CBD is inserting, ampulla of Vader ke wahan, there is this dilatation. Like you have ureterocele, the dilatation at the insertion, you have this choledococele. Right? So remember the choledococele in the intraduodenal part at the insertion, that is seal, is going to be 3. Then you have 4, which is intra and extrahepatic duct involvement. Remember it as 4 is involving more, that is intra and extra both. It is more involvement. Even in that 4A is all involvement, intra and extra. And 4B is only bahar wala involvement. It is extrahepatic cyst, multiple extrahepatic cysts that you are seeing there. And then you have 5, which is the unusual one. It is Caroli's disease. Okay, so Caroli's is what is going to be type 5. Is this clear with everyone? Right, so look at 1A, 1B and 1C. 1A is cystic dilatation of the 1A is cystic dilatation of extrahepatic common duct. B is just a focal bulge, focal dilatation of the extrahepatic common duct. And C is the fusiform dilatation of the CBD extending into the common hepatic duct. Right, so at least remember that 1 is what is involving out, that is extrahepatic duct, is what is involved here, cystic or fusiform dilatation. Okay, is this clear with everyone? Yes, 2 is diverticulum, 3 is seal, 4 is more, intra plus extra, like intra plus extra is 4A, all involvement, B is bahar, only extrahepatic, and 5 is intrahepatic Caroli's disease. Okay, that is going to be intrahepatic Caroli's disease. Can someone tell me what radiological sign do you see in Caroli's disease? So in the CT scan, liver mein, what do you see in the Caroli's disease? Anyone, what do you see in Caroli's? Remember C for C. What is this? It is the central dot sign which is seen in Caroli's disease. Central dot sign is what is seen in Caroli's disease. Okay? Right? So that was for Todani's. Going to CEAP classification, which is for chronic venous disease, varicose veins, venous disease. Right? So remember the mnemonic for that, very easy trick to remember, it is C. Remember CEAP is C. What do you see? TV Isha, right? Isha TV channel dekho, not the fashion TV or something else. It is C TV Isha. So TV Isha is what is your mnemonic for CEAP classification. It is telangiectasia, varicose veins. Then you have this edema, skin changes, healed ulcer and active ulcer. Right? 1 TV Isha, skin subcutaneous, healed and active. Telangiectasia, varicose, then you have E for edema, right? And then you have S for skin subcutaneous changes, H for healed ulcer, and it is going to be active ulcer. Now, even in the C4, you have A, B, C. So, how do you remember that? Again, remember 4A. Write it as eczema, starting with A. Eczema is what you have in 4A. B is going to be bi and di. B, bi, di. So remember bi, it is blanche, bi, blanche, and it is di, dermatosclerosis. So lipodermatosclerosis, atrophy, blanche. C for C, corona phlebitictica, right? Like a crown, corona phlebitictica is going to be 4C. Is this clear with everyone? A previous NEET PG exam question, like let's say when you have 2A and 2S, what does the 2A stand for? A is asymptomatic, S is going to be like symptomatic. So A is going to be asymptomatic, right? Is this clear with everyone? So it is TV Isha, very, very easy trick. C, TV Isha. Going to next one, Alvarado score. What is Alvarado score used for? A for A. Alvarado score is used for acute appendicitis. That is your first trick there. And Alvarado score, what is a mnemonic for that? It is mentrils. What is included? In one of the recent exams, it was asked. Mentrils is migration of pain, anorexia, nausea, tenderness, rebound tenderness, rebound pain, elevated temperature, leukocytosis, and shift of WBC to the left. So Alvarado is mentrils score. Okay, that is mentrils. What is included, what is not included, you should know this. Now, important is what feature, what criteria, because a recent question had asked about calculating the Alvarado score. So, each of these is given a score of 1, except for 2, which are given a score of 2. What is that one? Remember, 2 is given, what is given a score of 2 is tenderness in the right lower quadrant and leukocytosis. Please remember it is tenderness and not rebound tenderness. So how do you remember this is a score of 2 is given to 2, right? 2 score is given to T and W. T for tenderness in the RIF and W for WBC count increased. Remember, it's not rebound tenderness. Okay, it's not rebound tenderness but tenderness, right? Baki mentrals में बाकी सबको दिया गया score of 1. The maximum score that you have is a score of 10. ठीक है, so score of 2 is tenderness and WBC count increased, leukocytosis. ठीक है, clear with everyone? Right, so that was about Alvarado. Going to Ranson's criteria, right? In acute pancreatitis, Ranson's criteria, what features, what criteria are included at admission and what criteria are included at 48 hours. So you are asked question, which of these is not included as a criteria in Ranson's criteria at admission or at 48 hours. So how will you remember that? Right. So remember, when you have a patient of acute pancreatitis, the doctor says IV या injection लगाओ. Right. So पहले हम बोलते हैं on admission लगाओ, injection लगाओ, and then the patient says, later on the patient says, that means later criteria is no injection, please बचाओ. So it is लगाओ and बचाओ. Right. So remember, लगाओ is L for LDH. Right, what is Lagao standing for? LDH. A for, there are 2 A's. Please remember, none of the A here in pancreatitis stands for amylase. Do not get confused. It is not amylase. It is age. G for glucose. Another A is AST. Right, because remember, in alcoholic patient, is AST more or is ALT more? What is more? So remember, raising a toast of alcohol, right? So remember, it is toast, that is AST, which is high. Alcohol leading to pancreatitis, so you look for AST, not ALT, right? And then you have Lagao, W for WBC. So that is what Lagao stands for. It is going to be LDH, age, glucose, AST, and it is going to be WBC. Okay? And then you have Bachao. What does Bachao stand for? Bachao is basically the base deficit, urea, that is BUN, rising. Then you have C for calcium, H for hematocrit, falling, not hematocrit rising, of course hematocrit falling. And then there is PO2, arterial PO2, and then you have water deficit or fluid sequestration. Okay, that is water. So what does Bachao stand for? It is base deficit, urea, that is BUN, which is there. C for calcium, H for hematocrit fall, PO2 arterial, and then there is water deficit or fluid sequestration. So please remember, calcium comes at 48 hours, not at admission. And what happens to calcium in pancreatitis? Does it increase or does it decrease? Remember, it is decreasing. Hypercalcemia leads to pancreatitis, and pancreatitis leads to hypocalcemia, right? All the saponification happening, the calcium depositing, the calcium goes low. Increased calcium leads to pancreatitis, and pancreatitis leads to hypocalcemia. Even this is tested very frequently, right? Very, very important. And if you see at admission, all the criteria are basically more. They are increasing. None of them is decreasing. So increased age, increased WBC, increased blood glucose, increased LDH, increased AST. Okay, the criteria that is decreasing here, remember it's PO2 and calcium. Okay. Clear with everyone? Ranson's criteria. We have discussed the bicep score vagera in the short course and the various signs in pancreatitis, all of that we have discussed in short. Okay. Going to next one, GCS score. It's a detailed story. The famous or the infamous love story of GCS, the mnemonic story that we have. 2, 1 standing for none, right? No response is 1. What is 2 for? All the short course subscribers would know this. 2 rhyming with shoe, 3 rhyming with tree, 4 their love grows more, 5 they get married and the girl becomes the wife, 5 is wife, and 6 is the wife beating with the sticks, right? So it is obey my commands or I'll beat you with the sticks. So that is going to be obeying commands, which comes M6 at the last. Right, so I'm not discussing that story in detail because वो खुद में एक बड़ी story है. You can watch it in the short course, surgery short video on the MedSynapse app. Okay. Going to next one, some other important trauma scores. Revised trauma score, very, very important. So what is included in revised trauma score? RTS is RTS, respiratory rate. T for the most important trauma score, the first score that you see is GCS, and S for systolic blood pressure. Please remember what is not included has been asked previously. Diastolic blood pressure is not included. Heart rate or pulse rate is not included. It is respiratory rate which is included. So remember, RTS itself is the mnemonic for revised trauma score, respiratory rate, trauma ka GCS, and systolic blood pressure. Which other score has the similar components like RTS? Yes? Which other score has the similar components like RTS? Same 3 components. They come in Q-SOFA score, right? The Q-SOFA score has the similar components like RTS, respiratory rate, trauma, and systolic blood pressure. Correct? Yes. Going to next one. What are the components of TRIS, guys? TRIS is another trauma score. Trauma severity, injury severity score which is there. The mnemonic for TRIS, remember it as TRIS is an actress, right? Rhyming with TRIS is actress. What does actress stand for? A is age. C is cause, that is mechanism of injury, right? Now, ISS is what is included here, the injury severity score, which is a score in itself. And do this TR reverse RT, it is RTS. So you have age, cause, that is mechanism, RTS and ISS, which are the components of actress. RTS के जो 3 components हैं वो actress में include करते हैं, right? Because RTS complete is involved. So remember, TRIS is actress. Okay, that's your mnemonic there. Going to next one, MES score, which is Mangled Extremity Severity Score, which is basically for extremity, that is limb injury, whether the limb can be salvaged or it needs amputation. That is what the MES score is done for. So what is the mnemonic for MES? Remember, Eliza is a girl who likes the mess, right? Messy girl, Eliza. So mess, Eliza loves mess. Okay, that's how you remember. So remember, Eliza loves mess. So Eliza is energy of the injury. LI is the limb ischemia. Then you have shock and age. Okay? So remember, energy of the injury, that means is it skeletal or soft tissue injury? Low energy, medium energy, high energy, right? So what kind of injury it is? Neurogenic injury, remember that's a previously asked question. Neurogenic injury is not involved here. in MES score. लिम्ब इस्केमिया है कि नहीं है, शॉक है कि नहीं है, और एज कितना है, राइट? सो रिमेंबर एलिजा इज एनर्जी, लिम्ब इस्केमिया, शॉक एंड एज. Okay, shock and age. Going to next one, right? So those were the trauma scores that we had. Going to the CTP score. CTP score. What is CTP score done for? Child score. Child. Chilled score. Child score. Chilled is done for cirrhosis. That is cirrhosis का severity देखने के लिए. Right? So you get the various scores and you have class ABC, the severity of cirrhosis, compensated, decompensated cirrhosis. That is what you get to know there. What is the mnemonic for child score? The mnemonic is, remember, every child has एक बाप. है ना? When you are making mnemonics, right, you have to have mnemonics which help you relate that what was this mnemonic for, right? So if you remember like ABCD or something like that, you have to recall then ki what was this mnemonic standing for. Was that MELD score, or was that child score, or was it some other score? So better that if you relate that what topic ka mnemonic is it, then it becomes easy to remember. So you remember that every child has ek baap. So it helps you to remember that for child score, the mnemonic is ek baap, right? Ek baap is one father. Every child has ek baap, right? So remember E for encephalopathy. Then you have bilirubin. P for PTINR. What are the two A's which are coming here? Remember, one is albumin and one is ascites. There is no AST, no ALT in cirrhosis. No AST, ALT come in child score. It is albumin and ascites. How do you remember that? Albumin, if you see, albumin is all. It is present in all liver scores. Okay. And ascites, remember CICI, it is present in child score. So ascites, because cirrhosis mein ascites hota hai. So that is going to be ascites. AST, ALT, right? It's generally high in the hepatitis. So yahan pe cirrhosis mein hum include nahi karte hain. It is going to be albumin and ascites. Clear with everyone? So it's encephalopathy, bilirubin, ascites, albumin, and PTINR. Is this clear with everyone? Yes? So that was about child score. Going to MELD score, the model for end-stage liver disease. So this is for the end-stage liver disease, patients with end-stage liver disease who need a transplant. So to prioritize that, if there are 3 candidates who need liver transplant, which patient should be prioritized? Who should be given the transplant first? For that, you have this MELD score. Okay. So remember that in the end stage, any crime investigation, what bureau comes at the last in the investigation? What comes at the last is CBI, Central Bureau of Investigation, right? अगर local वाले bureau solve नहीं कर पा रहे तो central वाले आएंगे at the end. So end stage में आता है CBI, that is creatinine, bilirubin and INR. No confusion here. Okay, this was the original MELD score. So if you have question like this, that which of the following is not a component of MELD score, these are the 3 options, and the 4th option is albumin, then the best answer to go for is going to be albumin, because in original score it was not included, right? But to make our mnemonic true, right, where we said that albumin is included in all the liver scores, albumin has been included in the updated MELD score. So what are the components that have been included in the most updated MELD score? What components? Remember CBI, फिर उसमें CBI solves the crime case, then there comes the CBI के fan, right? So all of us become fan of CBI when they are able to do the justice, right? So remember fan आ जाते हैं फिर CBI के fan. So FAN stands for female sex, albumin levels and sodium levels. Okay, so FAN is added here, female, albumin and sodium. Is this clear with everyone? Right, so that is MELD score and the updated one. Going to the next one, the Strasberg classification, which is basically for post the cholecystectomy में क्या injury हुई है to the biliary tract. Right, cholecystectomy, laparoscopic cholecystectomy में injury happening to the biliary tract, उसके लिए you have this Strasberg classification, A, B, C, D, E, right? So if you have cystic duct leak without any transaction, without any ligation, what Strasberg classification is it? That's going to be Strasberg A, right? So what is the trick to remember this Strasberg classification? Remember A for ऐसे ही लीक हो रहा है without any occlusion, without any ligation. बस ऐसे ही लीक हो रहा है from the cystic duct or a duct, the right aberrant hepatic duct, right? So remember it is A. ऐसे ही the leak is happening. B for बंद. The duct has got band. That means there is occlusion which has happened. Occlusion of a part of the biliary tree, usually the aberrant right hepatic duct. C for it is cut. C for cut. That means there is transaction which has happened, right? There is a cut. There is transaction of the aberrant right hepatic duct. D for if this is the main CBD, there is this duct lateral wall injury making the duct look like a D. There is lateral wall injury to the major bile duct, a lateral wall injury. And then comes the E, Strasberg E, which is basically similar to the Bismuth classification for the strictures that we have. You start the strictures from below and go upwards. So if you look at E1, E2, you start the stricture from below and then the stricture goes above and above, right? So when you have E1, there is CHD stricture with the stump remaining which is more than 2 centimeters because the stricture is below. Stump more than 2 is going to be E1. Stump less than 2 is going to be E2. Then remember it is 3. What is 3 basically for? When I write 3, imagine like these are the two ducts, the right and the left hepatic duct, which are coming together at the hilum. So it is involving the hilum, but there is preserved confluence. And 4 is more. That means now at the hilum, the confluence is also gone. That means there is no communication between the right and the left hepatic duct like you are seeing here. At 3, this confluence is maintained. At 4, there is no continuation, no communication between the right and the left. So 4 is more. And 5 says high 5. The aberrant right hepatic duct and the main duct both are involved. They say high 5. Mera bhi injury, tera bhi injury, right? Dono ka injury, so it's high 5. Both are injured, right? So remember that A is aise hi leak either from the cystic or the aberrant right hepatic duct. B is band, that means there is occlusion which is happening. C is cut, there's a transaction which has happened. And D is the lateral wall injury. Is this clear with everyone? Repeating again. A, aise hi. B, band. C, cut. D, lateral wall injury. E1, E2. 3 is the hilum but confluence maintained. 4 is more. The confluence, the communication is also gone. And 5 is high 5. The aberrant right hepatic duct along with the CHD is gone. Okay, clear with everyone? Yes. So those were the quick mnemonics for today, discussing the most important scores and classification in surgery. You know, there are many more mnemonics and tricks that we have learned in the short and the short extra edge course on the MedSynapse app. So if you are still struggling, right, to remember all these stuffs, you can learn all these tricks on the MedSynapse app. And also we are posting a daily mnemonic, like 50 days, 50 mnemonics challenge on our YouTube channel as well. Plus there is daily a motivational video going on. Plus we have for the subscribers daily morning MedConnect sessions which are there, the Zoom live sessions where we do meditation and visualization followed by a rapid fire revision of some 20 most important one-liners, mnemonics, PYQs, right? So you can make the best of it even now for your upcoming exam, right? So if you're still struggling with the stagnant GT scores, not able to remember all of this, please make the best use of the short course. Okay, I'll be sharing this PDF. The annotated PDF also will be uploaded as a free PDF on the MedSynapse app in the free courses, right? So mnemonics demo करके एक टाइल दिखेगा आपको MedSynapse ऐप पे, उसमें आपको इसका वीडियो, ब्लैंक, एनोटेटेड PDF दोनों मिल जाएगा. ठीक है? Right. And guys, if there is anything else that you want me to discuss in the coming days on YouTube as well, there is some particular topic that you are struggling with, or you need mnemonics for some subject, some topics, please let me know in the comments of this video so that I shall work upon it and we shall have the next YouTube live session on that as well. Okay? Right. So thank you so much everyone for joining in, and I'll see you again very soon. All the subscribers, short subscribers, we'll meet tomorrow for the mini GT discussion. It's a very important mini GT that you should definitely give because it's all based on PYQs and PYTs. So a good assessment test for you to see how you fare in that. Okay. Advik. See, Advik, whenever you get worried, ask yourself this question: can I do something about it or can I not do something about it? Right? So whatever you can do, the best, staying wherever you are, right? Keeping her in prayers, right? Praying for her. Please do that, and trust me, everything will be taken care of. Leave it to the Almighty. You have been taken care of so well so far, so now also you'll be taken care of, provided you give him the responsibility. So leave it all up to him and do the best that you can, just staying wherever you are, and things will fall in place, right? Everybody has the ups and downs, and everybody's life are there. We just need to cope with the best way that we can. Yes. Okay, so a lot of you are saying कि cancer staging वगैरह का चाहिए, and ठीक है. Physiology short sprint has already been uploaded on this YouTube channel. You can watch it. Most important mnemonics of physiology, anatomy, pharmacology, biochemistry, medicine have been already discussed on this YouTube channel itself. Okay. All right. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, keep MedSynapsing, and keep winning. Thank you.